Hello and welcome to Medical Dialogues. I'm Roshnita. Let's look at today's top medical highlights. Study reveals insights into tacking diabetic kidney disease with a side order of how anti-obesity drug work. Data from Australian researchers could partly explain why a trial of a new drug for diabetes was recently halted because it was found to be so effective. Importantly, the data also reveals how anti-obesity drug like Ozempic actually work, which to date have been a mystery. In early November, the FLOW trial of the drug semaglutide on the progression of renal impairment in people with type 2 diabetes and chronic kidney disease was halted ahead of schedule because of the drug's efficacy. Part of the rationale for the cessation of the trial could be explained by research led by Monash University's Associate Professor Melinda Coelhan and published in the journal Kidney International, showing that a drug that targets a particular hormone GLP-1 also interacts with a receptor called RAGE to control the kidney damage that is the hallmark of type 2 diabetes. Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below. Cell therapy appears safe and effective for lymphoma in remission. A study led by researchers at Sylvester Comprehensive Cancer Center at the University of Miami Miller School of Medicine suggests that CAR-T immunotherapy remains a viable option for patients who have lymphoma that goes into remission before the cell therapy begins. Most patients receiving cell therapy, a form of immunotherapy that uses immune cells engineered to recognize and attack the patient's cancer, desperately need it. For some, it comes after many other treatments have failed, but Wang noticed an odd phenomenon in the past few years when treating lymphoma patients with this form of therapy. Some of his patients went into complete remission before the cells were touched their bodies. Marijuana cigarette smokers at increased risk of emphysema. Smoking marijuana in combination with cigarettes may lead to increased damage of the lungs' air sacs, according to research being presented at the annual meeting of the Radiological Society of North America. It is commonly believed that smoking marijuana is not harmful to the lungs. There is an abundance of established research that identifies the harms of cigarette smoking. In contrast, very little is known about the effects of marijuana smoking, and even less research has been done on the combined effects of smoking marijuana and cigarettes. The researchers said that marijuana is the most widely used illicit psychoactive substance in the world, and its use has increased in Canada since the legalization of non-medical marijuana in 2018. Researchers also said that currently not much research exists on the effects of marijuana smoking on the lungs. That's all for today. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.